Welcome to the next hearing in our review of the past, present, and future of SNAP. Today we'll discuss and examine the government's duplication and inefficiencies of the Supplemental Nutrition Assistance Program. Taxpayers and recipients deserve a thoughtful and thorough review of SNAP. They also deserve to know its relationship with other nutrition programs and how that affects families around the country, as well as taxpayers. I want to stress the importance of today's hearing and the committee's goal to ensure SNAP has a clear mission and operates accordingly. That goal should help Americans, both helping to recognize no one should go hungry and highlighting the value of helping to get people out of poverty. As we heard in the last hearing, our government is not alone in supporting the nutritional needs of Americans. Today we'll look inward at how government nutrition assistance programs operate. According to GAO, there are at least 18 different nutrition assistance programs, and together they spend roughly over $100 billion annually of taxpayer funds. While SNAP accounts for $3 out of $4 of that today, it's not alone in providing nutrition assistance. Over the past several decades, numerous programs have been created to target various populations with little to no regard in coordinating with existing programs or concern for overlap. This has created a web of programs causing confusion for recipients who are trying to feed their families and difficulty for states trying to administer these programs. The reality is that a majority of SNAP households are also eligible and receive benefits from one of the other major nutrition assistance programs. In some cases, multiple programs might be funding the same meals. For example, recipients may receive USDA commodity food packages through the Commodity Supplemental Food Program while also receiving SNAP benefits. What impact does that have on a family? Is there a duplication while there are still needs that are not being met? We want to ensure every person has access to food, and this overlap could be causing confusion in the system, in some cases overlooking individuals altogether who do not have access to any of these programs. Our job today is to figure out where the overlap, duplication, or inefficiency exists. Then we can expertly target our limited resources to places with potential unmet needs or weaknesses in the system. Let's continue this conversation and begin to understand how to best serve all families, because we can always do better. I thank all of our witnesses for being here with us today and look forward to their testimony. I would now like to recognize Ranking Member McGovern for his opening statement.
Well, thank you very much, Chairwoman Walorski, and I want to welcome all the witnesses here who are here to testify. Today's hearing is supposed to focus on duplication and unmet needs. Let me just begin with duplication. Duplication implies that the same people are getting kind of the same benefit twice, or and I think and my experience has been that that's really not a problem. You know, our food and nutrition programs are designed to meet the unique needs of the diverse populations that they serve. Now, let's take senior citizens, for example. Meals on Wheels serves homebound senior citizens, while CSFP and SNAP provide food assistance to those who are more mobile. And so, you know, even within the senior population, there are kind of distinct needs, unique needs that these various programs meet. And so, even within the same population, there are different needs. I'm sad to say that in this country today, there are still too many people who are hungry, and there are a lot of unmet needs, and I will agree that there are unmet needs in our food and nutrition programs. During the school year, the school lunch and breakfast program do a good job of providing nutritious meals to kids, but then in summer, only a fraction of the kids who receive free and reduced price meals have access to summer meals. And let me also just say something that I think should be crystal clear to all of my colleagues here. The SNAP benefit is too low. If you want to talk about an unmet need, there it is. When I talk to food banks and food pantries, they talk about an uptick in utilization by people who are on SNAP. The benefit doesn't last the entire month. It is too small to meet the nutrition and food needs of the average family. So if we want to talk about a reform, we ought to be talking about a benefit that actually meets the need. I would like to have a discussion about how we could put food banks out of business. And one of the ways to do that is to make sure that those who need a benefit like SNAP actually have an adequate benefit. And I'm going to make another point, and that is that, that one of my frustrations over the last few years is that I think Congress has been so focused on trying to demonize the program, and try to find some fault with the program, even when there's no fault, that we have actually passed legislation that has actually made the situation worse. I mean, I think last year's Farm Bill, a lot of good things in the Farm Bill, but when it came to SNAP, it cut the program. And I think I think many of us, especially those of us in LIHEAP states, have seen the detrimental effect that it's had. So, look, I think it's important for us to talk about how we can do better. But I don't think we should fool ourselves into believing that charities can pick up the slack, or that somehow, you know, there are too many nutrition programs out there, therefore we're not, that's why we're not meeting the need. The fact of the matter is we're not meeting the need because the government, in my opinion, is not adequately investing and responding to the real need that's out there. So I thank the Chairwoman for giving me the time, and I look forward to hearing our witnesses.
Thank you, Mr. McGovern. The Chair would request that other members submit their opening statements for the record so the witness may begin testimony, and to ensure there's ample time for questions. The Chair would like to notify members they'll be recognized for questioning in order of seniority for members who are here at the start of the hearing. After that, members will be recognized in order of arrival. I appreciate members' understanding. Witnesses are reminded to limit their oral statements to 5 minutes. All the written statements will be included in the record. And this time, finally, I'd like to welcome our witnesses to the table. Kay Brown, Director, Education, Workforce, and Income Security, U.S. Government Accountability Office. Angela Rashidi, Research Fellow, American Enterprise Institute. Joe Nader, Executive Chef, Ford Field, and Volunteer Chef for Share Our Strengths Cooking Matters. Sherry Tussler, Executive Director, Hunger Task Force, Milwaukee, Wisconsin. Ms. Brown, please begin when you're ready.
Thank you. Chairwoman Walorski, Ranking Member McGovern, and members of the subcommittee, thank you for inviting me here today to discuss federally funded nutrition assistance programs. I will provide an overview of the programs and an update on the status of our 2010 recommendations on program overlap. Starting with how much the programs cost. In fiscal year 2014, the federal government spent more than $100 billion on 18 federal domestic food and nutrition assistance programs. Program spending ranged from approximately $5 million for a community grant program to more than $74 billion on SNAP. The 5 largest food assistance programs, SNAP, School Lunch, WIC, School Breakfast, and the Child and Adult Care Food Program, accounted for 96% of total spending of the 18 programs. SNAP is by far the largest at more than 70% of the overall total. 4 of the 5 are entitlement programs. WIC is not. Since we issued our report in 2010, federal spending on these programs has increased by about $40 billion, primarily due to increased spending on SNAP in response to the economic crisis. Now next, do they work? In 2010, we found that participation in 7 of the 18 programs, including 4 of the 5 largest, was associated with positive outcomes. These outcomes are consistent with program goals, such as raising the level of nutrition among low-income households, safeguarding the health and well-being of the nation's children, and strengthening the agricultural economy. Regarding the remaining 11 programs, we found that little was known about their effectiveness because they had not been well studied. So why do we have multiple programs? These 18 programs provide assistance through a decentralized system that involves multiple providers. 3 federal agencies, USDA, HHS, and FEMA, numerous state government agencies, and many different types of local providers, including county governments and private nonprofit organizations, all play a role. This decentralized network emerged piecemeal over many decades to address a variety of targeted needs. For example, WIC dates back to the 1960s when a White House conference recommended focusing on the nutritional needs of low-income pregnant women and preschool children. The Emergency Food Assistance Program was created to utilize excess federal food inventories and assist states with storage costs while helping the needy. The advantage of having multiple programs is that they can help increase access to food for vulnerable populations. This diversity allows individuals to participate in programs that best meet their needs, whether it be picking up a bag of groceries from a food bank or completing the application process to receive SNAP benefits. However, This structure shows signs of program overlap. That is, multiple programs provide comparable benefits to similar populations, but are managed separately. For example, 6 programs provide food to eligible children in settings outside the home. Multiple programs provide food targeted to older adults, and several programs provide groceries and prepared meals to needy individuals. This overlap can create unnecessary work, waste administrative resources, and result in a potentially inefficient use of federal funds. Like other social programs, most food assistance programs have specific and often complex administrative procedures that federal, state, and local organizations must follow, which require staff time and resources. Now, about our recommendations. In 2010, we recommended the Secretary of Agriculture identify and develop methods for addressing potential inefficiencies among food assistance programs and reducing unnecessary overlap, particularly among the smaller programs. Although USDA has taken some steps in response to our study and a related study by its Inspector General, we believe that further action is needed. For example, we previously suggested that USDA convene a group that includes program representatives, state officials, and local providers. This group could develop proposals for cost-effective approaches to address these inefficiencies. In conclusion, we believe it's possible to improve the efficiency of the nutrition assistance structure while still ensuring that those who are eligible can receive the assistance they need. This concludes my statement. I'd be happy to answer any questions.
Thank you, Ms. Brown. Ms. Rashidi, you may continue with your testimony.
Thank you. Chairwoman Walorski, Ranking Member McGovern, and other members of the subcommittee, thank you for the opportunity to testify this afternoon on government duplication and unmet needs in federal food assistance programs. My name is Angela Rashidi, and I am currently a research fellow in poverty studies at the American Enterprise Institute, or AEI. I recently joined AEI after spending almost a decade working for the New York City Human Resources Administration, or HRA, the past 6 of which I served as the Deputy Commissioner for Policy Research and Evaluation. HRA is New York City's main social service agency and administers the Supplemental Nutrition Assistance Program, SNAP, and Emergency Food Program, along with other income support programs. My comments today draw from this experience and focus on concerns about duplication, inefficiencies, and burdens that are created by the complexity of our food assistance programs. The main points I will make are: 1, duplication and inefficiencies do exist in these programs as they are currently administered. The decentralized nature of the current system means that knowledge about families is lost, and families are ultimately hurt because the system is not set up to treat them holistically and government dollars are wasted. Before I address these specific points, however, I want to emphasize that the federal government's food assistance programs are an important part of our nation's safety net, and research shows that they do improve the health and nutrition of low-income families and provide very important needed support. However, given the large investments in food assistance programs at the federal level, finding ways to increase efficiencies is critical. As I said, first, there are inefficiencies built into the current system. In New York City, food assistance programs are administered by different agencies, and the result is that each agency must determine eligibility and administer benefits separately. This means that the process can happen more than one time depending on how many programs a family participates in. And not only is this duplication inefficient from a government perspective, but it also affects these families. A sizable number of households with low food security participate in more than one food assistance program, which can be unnecessarily burdensome on them when programs are not coordinated. Some coordination across programs already exists, such as with categorical eligibility. However, I urge caution on some of these efforts, as a recent GAO report on the school meals program found that the errors are common. The interest in reducing the burden must be balanced with the need for quality control and program integrity. In addition to eligibility determination, there are 3 other areas where coordination or consolidation may be appropriate, including setting nutrition standards, approving and monitoring retailers, and nutrition education programming. At the federal level, different nutrition guidelines and standards exist for different programs. Consolidating efforts around setting and monitoring nutrition guidelines should be explored. Approving and monitoring retailers in SNAP and the WIC program also operate out of different levels of government. The extent to which this duplication creates inefficiency should also be explored more, and areas for consolidation should be identified. Nutrition education programming is another area that deserves attention. In New York City, 2 agencies provide very similar nutrition education programs to very similar populations, one through HRA and the other through the Department of Health. Consolidating these efforts could also reduce administrative inefficiencies. A fragmented system also means that information is lost. Information about how the families are being served, as well as the nutritional programs themselves. Government agencies tend to operate in a silo, and this was true in New York City, which means information is not shared with families about other programs. An uncoordinated system also makes it more difficult to share information on participating households, which increases the opportunity for error, fraud, and abuse. A better system would be to consolidate programs that share the same goals and coordinate programs across governing bodies with a focus on the person and the household. This will save the government money and reduce the burden on participating families. I provided 3 specific examples where coordination could be beneficial: setting nutrition guidelines, authorizing retailers, and administering nutrition education programs, as well as reducing the inefficiencies in eligibility determination that I described earlier. The extent to which we can limit the burden on staff and on families by better consolidating and coordinating food assistance programs, the better these families will be served and the better the government's money will be spent. Thank you, and I can respond to any questions that you may have.
Thank you, Ms. Rashidi. Mr. Nader, you may proceed with your testimony.
Thank you. Good afternoon, Chairwoman Walorski, Ranking Member McGovern, and members of the committee. I'd like to thank you for the opportunity to share my experience and views on the importance of the Supplemental Nutrition Assistance Program, or what my family used to call food stamps. I'm the executive chef for Levy Restaurants and the National Football League's Detroit Lions. I'm also a volunteer chef with Cooking Matters, a program that teaches nutrition education and basic cooking skills to low-income families in the Detroit area. Cooking Matters works as a public-private partnership, leveraging both SNAP-Ed funds to community organizations and private funding from companies like Walmart. As a child, there were many times when things got tough for my family, as it did for many in the Detroit area in and around the auto industry in the 70s and 80s. There's nothing more vital to the success of a child than proper nutrition. During these tough times, we would rely on support from programs like food stamps, free school lunch, and the like. It wasn't always a long-term need, but there were times that support was needed for a brief period. I feel very strongly that the success in my life and my career is directly correlated with the fact that I had nutrition assistance early in my life. I experienced firsthand how SNAP and the school lunch program worked together to make sure I had healthy food I needed both at home and at school. I think one of the biggest misconceptions about SNAP is that families are on it for life. It's most often a temporary lifeline, as it was for my family. Families on SNAP are presented with very hard decisions when balancing budgets, from rent to childcare and basic needs such as nutrition. While I received free school lunch, my school didn't offer school breakfast. This made SNAP even more important to my family. I saw many of my friends who were coming to school hungry get stigmatized and labeled as having behavioral problems, which may have been alleviated by daily nutritious breakfast and lunch. We now have research that supports what happened in my classroom. A study by Share Strength and Deloitte found that students who eat school breakfast score up to 17.5% higher on math tests, miss fewer days of school, and are more likely to graduate. I have also personally experienced the stigma of being from a low-income family. Childhood hunger and food insecurity crosses many demographics and socioeconomic areas. It's urban, suburban, and rural. Hunger is the face of many Americans. As I look back, I realize the fact that my family had the cooking skills in place to stretch the few dollars that we did have for the food, and we were able to maximize our SNAP benefits. This was a driving force for me getting personally involved in helping others today. I discovered Share Strength's Cooking Matters program operating through Gleaners Community Food Bank in Detroit about 3 years ago. I was delighted to see such a program that teaches low-income families nutrition education and basic cooking skills. It made me think of how many of my friends' families growing up could have benefited and subsequently maximized their very modest food budgets. They could have been empowered to shop smarter and cook healthier on tighter budgets. I'm very fortunate to work for Levy Restaurants and the Detroit Lions, as they are both very active in our communities and support the work that I do, providing nutrition education to make sure families are able to maximize their benefits. We all believe that nothing is more important to child development than proper access to food and nutrition. We realize that SNAP is an effective way to give parents the power to feed their families when times get tough. In Cookie Matters, I see families who get SNAP and school breakfast. Parents tell me SNAP works effectively when it works in tandem with other programs, like school meals. School breakfast ensures that kids can start their day with a healthy meal to fuel their brains and help them focus on their lessons, rather than a growling stomach. This allows these parents to stretch their existing food budgets and SNAP dollars longer into the month instead of running out. In this nation, we have enough food, I believe. It's unacceptable that any child in this great nation could go hungry. When I was a kid, this program allowed me to get the nutrition I needed to grow up and be a success. We need to continue to invest in our kids and in America's future. This is a matter of potential. When I look at a child who is struggling with hunger, I see a potential future doctor. I see a potential future programmer, computer programmer. I see a potential future chef of the Detroit Lions. I see a stronger workforce and a stronger America. But in order for that to happen, we must ensure our children are fed. SNAP can help these kids grow up to achieve these dreams. For all of these reasons, I'm here to urge you to protect SNAP funding, as it is an effective way to give parents the power to feed their families when times get tough. I have lived this personally, and I see it every day in my work in the Detroit community. Thank you all so much for your time and attention to this very important issue. Thank you for the opportunity to come here today and speak and tell my story, and I welcome any questions.
Thank you, Mr. Nader. Ms. Tussler, please proceed with your testimony.
Thank you for inviting me to testify today. I am Sherry Tussler. For the past 17 years, I've been employed as the Executive Director of the Hunger Task Force in Milwaukee, Wisconsin. Our anti-hunger public policy organization operates a food bank, a farm, and a self-service welfare office. We administer the Emergency Food Assistance Program, the Commodity Supplemental Food Program, the Emergency Food and Shelter Program, and the Supplemental Nutrition Assistance Education and Outreach Programs. We also organize a nationally recognized summer meals collaboration. I know most of the federal nutrition programs very well, and I serve as an issue expert on the federal commodity and funding programs, as well as SNAP and the Summer Food Service Program in my home state. I understand how the federal nutrition programs are supposed to work and how they actually work. I work directly with children, adults, and seniors in need of the programs and who, in fact, rely upon them to meet their very basic needs. I have grown accustomed to explaining the reach and the limits of the federal nutrition assistance programs. I've convinced donors to substantially backfill these programs and what they don't provide. And although I laud the intent of most of the programs, I also see their limits as an embarrassment to the government and the people. I surely believe that there's enough food, healthy food, in the United States to feed every single one of its citizens. I know that you have concerns that the federal nutrition programs are duplicative. You want to save tax dollars and create efficiencies. But what I see is a patchwork of underfunded programs layered around the shortfalls of SNAP and the National School Lunch Program. And while these programs serve certain populations well, they also fall short of their intent due to limits of funding or regulation. For instance, the Commodity Supplemental Food Program is overregulated and so influenced by its budget that its program intent is regularly distorted. It mandates that what seniors can eat, but its budget doesn't match the mandates. As a result, seniors get foods that they can't or do not want to eat. The Child and Adult Care Food Program doesn't allow youth 13 and older to have supper, while the Summer Food Service Program will, but only if they hadn't had lunch. This is a cost savings measure that leaves older siblings of younger children without food in after-school programs. Although we know the value of fresh foods in our diet, commodity foods aren't fresh. The foods doled out to food banks, school meal programs, and seniors are canned, boxed, and bagged at a cost savings measure. Milk is instantized, and chicken leg quarters come in 20-pound bags. SNAP is under a great deal of scrutiny for serving able-bodied adults. Do we really need to explain why able-bodied adults need food? There are lawmakers in my state who would invest the very tax dollars they seek to save in illegal and costly drug testing, photo identification for SNAP, and current work requirements will result in a loss of food buying power under SNAP for up to 3 years for 67,000 people in Wisconsin alone. Somehow we have determined that punishing people with hunger will motivate them towards work. Hunger doesn't motivate. It dulls and it makes people sick. As you consider these programs, remember that all children should be fed when they are in our care and it is mealtime. Teenagers are children. They equally merit a healthy diet. Home-delivered boxes of food for seniors should include food they can and should eat. If we can't fulfill this promise, we should provide seniors with SNAP benefits sufficient to be healthy. In my opinion, the balance between agricultural price supports and the intent of the federal commodity programs is tipped in favor of food producers and must be rebalanced. What works? SNAP. SNAP is the one program that makes the most sense to me. It supplies food buying power that stimulates our economy. It normalizes and humanizes how people get food when they need help. SNAP is not dictatorial. It lets you shop for food you prefer, and its limits are practical. SNAP is not bound by age or who it can serve. Unlike all of the other federal nutrition programs, SNAP doesn't make you the victim of overregulation. What else works? The community eligibility provision. It creates dignified access to all children for school meals. Your concern for program duplication should be balanced with the knowledge that the federal nutrition programs do not meet the need. Funding for these programs is wholly inadequate, and the evidence of this is the billions of dollars that private sector plows into buoying their shortfalls. Food banks, soup kitchens, homeless shelters, and food pantries feed millions of hungry Americans shorted by these programs. And no matter how reputable, food banks are a scourge on our nation's reputation. We should put them out of business because the grocery store is where food comes from, and the most dignified way to get it is to buy it with your wages. The day we no longer need food banks is the day that we end hunger in America, and I believe that together we can. Thank you.
Thank you, Ms. Tussler. Thank you for all your testimony. We appreciate it. Now we move to the question portion. A consistent theme throughout the testimony of our panel has been the potential for greater administrative efficiency. So within the United States, in the example of New York City, we've heard there are various agencies administering nutrition programs to similar populations. This is not only confusing for the states and localities trying to administer these programs, but for recipients who are trying to piece together different forms of nutrition and assistance to feed their families. The question first to Ms. Brown, can we improve administrative efficiency without sacrificing program integrity? And the kind of second question there, is it a direct trade-off, a zero-sum game?
Well, there was just a report that was released recently about the school meals program that shed some light on that, where it was determined that when children in the school meals program are automatically made eligible because of their participation in the SNAP program, that the likelihood of error in their eligibility is much smaller. So in fact, by sharing eligibility across those programs, they have increased the likelihood of they've decreased the likelihood of error in that program. So there are some real possibilities that we can do better even right now. I do want to say, though, that there's kind of a cautionary tale here, and that is that sometimes when we have those automatic eligibility provisions, we end up with unintended consequences that might result in certain program participants receiving benefits when that may not have been the intent of Congress. So we have to kind of keep an eye on that if we're going to do those automatic eligibilities.
Gotcha. And Ms. Rashidi, do you have any suggestions on how to improve administrative efficiency while maintaining the integrity of the individual program?
Sure. Well, I actually think that you can achieve both goals. I actually think you can achieve both goals, and I would recommend more data sharing. Ms. Brown just talked about, the data sharing where you have direct certification using SNAP data for the school lunch program. So I think areas in the other programs where that type of a model can be used would be very beneficial. And also in terms of program integrity, data sharing can also be used, I think, to a greater extent to ensure program integrity. Accessing databases at the federal level, allowing local agencies to access databases at the federal level to verify income, things like that can all not only help with administrative efficiencies, but can also increase program integrity.
And when you were in New York City, do you recall any barriers that were there any federal barriers that while you were operating in that state, you could look at and say, this is something that should be tweaked or could be helpful as in barriers that you identified?
Sure, and again, this was at the city level, but in terms of the data sharing, again, accessing federal databases, I'm not sure the particular reasons behind not accessing some of those data systems, but like Social Security income data, for example, wasn't accessible, and that would save a lot of administrative effort trying to track down income if that database was available to local agencies. So that was one particular example. The other is, I think that there's an opportunity now that technology has, made a lot of progress in revisiting some of the regulations among the USDA in relation to SNAP, and how using technology maybe can fit better with those regulations. For example, one thing in New York City, we were moving to online applications for SNAP, which involved a telephone interview of recipients. And one initial problem was that the regulations did not allow, recipients had to have a scheduled interview. It did not allow recipients to just call the agency at their convenience. New York City did apply for a waiver, and I believe now they have gotten that to allow recipients to do that, but that was one sort of roadblock that was at the federal level that created some problems.
I appreciate it. And Ms. Brown, one other question. As we look at this whole concept of streamlining the administrative programs, can we do that? Is there a way to do that without literally bumping into the statutes that Congress created?
I think there are some things that can be done without bumping into the statutes, but I think it's very possible that there might need to be some consideration of some changes. For example, even some laws and regulations specify who must do the eligibility determination. For example, with SNAP, it needs to be a state employee. So, there are things like that might have to be reconsidered if we were really going to look at this more holistically and think about some bigger changes.
I appreciate it. Thank you. The chair recognizes Ranking Member McGovern for 5 minutes.
Thank you very much. Ms. Brown, do you consider categorical eligibility a step toward efficiency and making the process more effective?
Yes, what we've seen in a number of different cases is that categorical eligibility, particularly when it's directly certified program to program, can be a major step toward efficiency, and also have positive benefits toward program integrity.
No, and I think that's an interesting point, because the whole concept of categorical eligibility was introduced basically to do what I think everybody here wants, is to make these programs more user-friendly and more effective and more efficient. And all of a sudden now it's become unpopular because people are actually, who are eligible, are getting enrolled in the program, and everybody's saying, oh my goodness, we didn't want that to happen. But the fact of the matter is that efficiency and effectiveness means that people who are eligible should be able to take advantage of the benefits of these programs. Does anybody, I mean, we talk about, effectiveness and efficiency and duplication, all that kind of stuff. Does anyone here believe that the current SNAP benefit is adequate for a family to be able to pay for the groceries they need for an entire month?
If I could.
Yeah.
In the state of Wisconsin, the average SNAP benefit is not adequate. I know that the Supplemental Nutrition Assistance Program is supposed to be supplemental, but one of the reasons why there may be duplication in services, a senior, for instance, receiving $14 in SNAP and simultaneously receiving a commodity supplemental food box valued at $50, who has less than $100 in additional income to spend after rent and utilities are paid. So, no, SNAP is not adequate to meet people's basic needs, and that's why you see what you think is program duplication and I think is a safety net.
I mean, and I'm happy to yield to Ms. Rashidi. I mean, but what I'm seeing, like in Massachusetts, is that people are looking for alternative programs to basically supplement their supplemental nutrition assistance program because they can't make it through the month. And I'm just curious. I mean, if we provided an adequate benefit, does that help alleviate some of the problem?
If I may, I do believe that the SNAP benefit is adequate for a large number of households that participate. For a family of 4, it is $650 a month. That's the maximum benefit.
Right.
We did a study in New York City where we looked at benefit redemption patterns over the month, and we found that the majority of families actually did not spend down their benefit levels early in the month, and they had benefits left over at the end of the month. Not all families, but
You're the first person who's ever told me that.
But the majority.
Yeah, you're the first person who's ever told me that. The people that I meet with regularly, and the people who I see at food banks are not there because they want to be at food banks, is they've run out of money. And so this is, I mean, I think your perspective on this is certainly different than my experience.
And I don't disagree with you. There are a number of families that cannot make it through the month, and they do have to participate, or they do have to go to a food pantry. What I'm saying is when you look at on the whole, most of the families, it's adequate. And we looked at administrative data, and we
Yeah, well,
were able to
I
confirm
respectfully
that.
disagree with you on that. Ms. Tussler, can you tell us about the LIHEAP provision that was in the Farm Bill last year? Have you seen an impact on any of the people you serve?
Yes, seniors and people with disabilities were unduly affected. Most of them were living in subsidized housing or apartments that had rent included, or heat included in the rent. And although the state said that we would lose, well, on average, $24 per senior per month in SNAP buying benefits, what we actually saw was $90 to $100. And so we're now seeing seniors giving up their apartments and trying to live with family members, becoming homeless because they don't have enough money for food at the end of the month.
So seniors have lost $90 to $100 in their benefit?
Yeah, I have an example of a lady named Molly who's 76, and she gets $898 a month in Social Security. Her rent is $500 a month in subsidized housing with heat included. Her medical expenses and hygiene, other products are $100, or leave her with $100 in excess income after the end of the month. After she lost her standard household utility allowance under the recent Farm Bill, her SNAP benefit was cut from $90 to $16.
I hardly believe that that's an adequate benefit for somebody to live on.
$16 a month.
Yeah. Thank you. Thank you.
Chair recognizes Ms. Hartzler for 5 minutes.
Thank you, Madam Chairman. First, I just wanted to commend, well, all of you, but certainly Mr. Nader on your program that you do. Your story was wonderful. I'm a former family and consumer sciences teacher. We used to call us home economics teacher. But what I did was a lot. What you're doing now is teaching nutrition education to families, how to budget, how to stretch those dollars. And so just keep up the great work there. And I'll give a shameless plug for family and consumer science education out there as well, because I think it's important in our high schools. I had a question for Ms. Brown. I guess I'd like to start with you. So in the last few years, we've seen a near complete coverage of free breakfast and snacks in low-income schools in addition to lunch. And we've seen growth in weekend backpacks of food. And I can tell you, my district, there's so many wonderful communities and people who are helping with that. And now we're seeing the expansion of dinner at school. So I guess just on a administrative viewpoint, how does this impact the family's SNAP benefit if the child is receiving nearly all of his or her meals at school?
Well, 2 points. One, a family SNAP benefit would not be adjusted depending on whether they were getting other school meal benefits. Those school meal program benefits are intended to complement the SNAP benefits and not cause a reduction. The other point is that I mentioned in my statement that USDA has taken some action, and one of the things that they are planning to do is conduct a study that looks across the larger food assistance programs and see what participation in multiple programs, what effect that has on the nutritional intake of different families. So we'll be very interested to see the results of that.
When do you think that'll happen?
I don't think they've started it yet, and I suspect it's going to be a pretty challenging project.
Sure. So that would include WIC as well. So like would a mother and child under 5 receive WIC? Is there any interaction with the household SNAP benefit? Then there's...
Again, our understanding is that none of the food assistance programs are intended to fill all of the nutritional needs of a family. So it would not be inconceivable for a family to receive SNAP, and then if they had very young children and school-age children, also receive WIC and school meals.
Okay, great. You mentioned in your testimony that the SNAP is achieving 7 of the 10 goals of SNAP, and I was just interested in what those are. Do you have what those 10 are, and could share what the 10 goals of SNAP are?
7 of 10 goals. I think what I said was that 7 of the 18 programs were found to be effective, and SNAP was one of them.
No, you talked about goals of
Right.
making sure that children were fed and things
Right.
like that. So I was curious what what are the goals of the
Okay.
SNAP?
Well, the goals of SNAP are related very much to providing families with income so that they can improve their nutritional intake. And that's one of the things that we know that the program is actually achieving.
Okay. If you could get me later what the specific goals are, that would be helpful to me. I just think that's be very helpful. So, and one more question here. So as far as about the funding of the programs, there's no spending limits per se in each program, right? It's if someone is entitled to it.
With the top
There's no
programs,
caps.
right, the top programs are all entitlements with the exception of WIC, which is not an entitlement, but has been, in the past several years, able to to meet the demand for those benefits.
I'm sorry, I was reading here. You might have just said, my final question is, so if there's no limit on any of them, why is SNAP the only one with the economic times that has seen their large increase?
Well, you know, the graphic in our, in my statement made it look like SNAP had a huge growth and the other programs didn't. The other programs also experienced some growth as well, but SNAP is intended to and traditionally respond to changes in the economy. So when the economy goes down, SNAP participation goes up. So that wasn't a surprise. And in addition to that, the benefit level for SNAP was increased under the Recovery Act, which made the increase in the program spending that much bigger.
Okay, thank you. I yield back.
Chair recognizes Congressman Ashford for 5 minutes.
Thank you. If I might ask Ms. Tisler a little bit about Wisconsin. We have tried to, in Nebraska, do some things to expedite and be more efficient in the application process for SNAP. And I know, maybe you touched on this, but in Wisconsin, you've done some things that have been very innovative and successful. Could you, on the delivery itself, am I correct? Could you go over some of those for me?
Sure. Wisconsin modernized its food stamp application process because we weren't timely. We were routinely getting fines assigned from the federal government. And what we did was we created an online application, both for food share as well as now Medicaid. And people can go online, they can apply. In response to Ms. Rashidi's comments, they can have a telephonic interview. The interview lasts about 6 to 7 minutes. They can have a telephonic signature, which is a voice recording of them saying that they testify to the veracity of their claims. They can submit verification of their application, proof that they pay rent, proof of what their income is, proof of everything. I always say it's proof of anything you say yes to via a scan or a faxed document. And so you no longer have to go to the welfare office in order to apply for food share or SNAP. We call it food share in Wisconsin. And you can, as a result, have a more dignified access to the program. It can make better sense for you because it's online 24 hours. And for a lot of seniors, it's been a welcome because they were often frightened to go to the locations that the welfare office was at in Milwaukee.
And so do you have some data then on how that has worked across the system? With elderly recipients, it's been a good thing. Has it also been the same for younger recipients, or how has it worked with all elements?
Well, it improved program enrollment, program integrity, program operations in general. We reached the point in Wisconsin where we were actually getting bonus funding on a regular basis, and so we turned it around in effect. And I know a lot of groups struggle with modernization. I think it still has places that it can go, including verification, because oftentimes we're chasing down some piece of paper that proves how much money we made or that we have a child in the house, when indeed the state already knows that about you. So I think that there can be connections between state databases and food stamp applications that would further improve program integrity and help customers verify, as well as reduce the cost of operating the food stamp program.
That's interesting. So we had some discussions earlier, well, there's testimony earlier, and we've had testimony before this about the need for more collaboration and data sharing. Just logically, it would seem to me that that kind of process would lead to more data sharing once you get people used to the process. Is that?
Yes, and it changes how people apply and who they apply with. You're still applying with a government level
Right.
employee, but they're processing more data as opposed to being a social worker. And so there's a lot less time spent face-to-face working with people and trying to consider their circumstances. Maybe there's a loss of other opportunities to talk to people about why they're in poverty or how they could get jobs, but the reality is that it expedites the process, it reduces the taxpayer burden in the administration of the programs.
And then going back to evaluate how it has worked or is working, that process, it seems to me, would also be helpful in that regard, correct? If we're doing research on the effectiveness of the program and how it could be changed or altered, this process would be a way to do that, or a way to get into that data.
Yeah, I absolutely agree.
Thank you. I yield back. Thank you.
Thank you. The chair recognizes Congressman Binishek for 5 minutes.
Thank you very much, Madam Chairman. Mr. Nader, good to see you again. Thank you for coming here to D.C. to talk about your personal experiences. And one of the questions that I have, and maybe you can tell me a little bit about it, I want to ask some of the other folks too. It seems to me that there maybe should be a more holistic approach to how we help people. And I'm not sure if is it possible that you can have one contact and get all the benefits that you're eligible for in one encounter? And the other thing I want to commend you for, and I think that many of our local nonprofits really assist people a lot in that area, and you know, job training and food assistance. And can you tell me about your experience and what you do a little bit more? And if you can relate to my thought here.
Sure. I mean, with the Cooking Matters program in general, it's a 6-week-long program where we're taking the folks or the kids through. It's about 2 hours, 6 weeks, so once a week, and it's general nutrition and basic cooking skills, and then it's capped off by a store tour. And for us in Detroit, we've had a lot of need. The economy's been rough, in particular there, as it has everywhere. But you know, the store tour for me too is a really important piece of that. Just the whole educational piece in general is essential to the success of any of these type of programs, because unfortunately, it's not really my expertise to speak to why people are in that position. However, I'm on the front lines of that in Detroit, and I'm experiencing many folks that don't have those basic skills.
Can you tell me a little bit about this? Is it a food wasteland, or an inability to find food in your neighborhood?
Food desert.
A food desert, yeah. And tell me about that a little bit.
In my community, there's many areas in and around that we have, you know, land areas that there aren't stores available, or if they are, they're like bodegas, or like what we call in Michigan party stores. And they have very limited food available that's in those, or the folks don't have access to a proper grocery store or food access in general. That pretty much speaks to
All right, thanks. Ms. Tussler, you heard my questioning here. I'm trying to think if there's got to be a better way of doing this, and then you said that as well.
Yeah.
Is there a way for someone to apply for all these benefits at one time? I mean, that doesn't sound like it exists. You know, that's why I mentioned the nonprofit, because sometimes these local nonprofits they can reach out to a lot of different sources.
Sure.
And help people negotiate the morass of bureaucracy.
And they often do. The Ohio Benefits Bank model is a model where nonprofits will sit down with you and talk to you about all the things you could be eligible for, and they'll give you a printout, but sadly, you still have to run to all of those places and try to apply for those benefits, so they're not coordinated at the state level.
Yeah. See, that's where I think that we could be helpful maybe here in our job.
You
And I
could.
think that's one of the, hopefully the results of these hearings is that we can streamline the process and make it easier for people to be, you know, find out what they're eligible for and make it easy. What about Mr. Nader's comment about the food wasteland?
Food deserts.
Food desert. Now, do you have experience with that? Because I worry about people being able to access food and not having to go to the party store and end up with a TV dinner or something.
Right. There are food deserts throughout the country. In Milwaukee, we have them as well. And people have to travel large distances in order to be able to access healthy or fresh foods at sort of the big box grocery store instead of the smaller store. And it's about land availability and land mass and sort of perception with large retail grocers that those people don't have any money to spend on anything.
It seems to me that most people that are in this situation, or a lot of them, don't have access to a vehicle where they can just drive to a grocery store.
And oftentimes, public transportation doesn't go where they live.
All right, well, I think that's an issue that we should kind of investigate as well, don't you think?
Yes, but very quickly, I used to run a homeless shelter in 1988 in Milwaukee, and we used to send people to the welfare office, and they could apply for Tanf, AFDC back then, food stamps and Medicaid, and they would walk out knowing what their benefits would be. They would walk out with paper emergency coupons. They would walk out with health insurance for their children. We took that apart.
All right, thank you, I'm out of time.
Thank you. The chair recognizes Congresswoman Delbene.
Thank you, Madam Chair, and I'd like to thank all of you for being here with us today. I really appreciate you taking the time. Ms. Tussler, you talked a little bit about that you also have a farm, and I was interested in what you grow and how you use that to supplement the food that you distribute and to food pantries or to people who are coming seeking help.
Sure. Milwaukee is primarily an urban community, but there was a work farm that was operated by our House of Correction, and we took that work farm over when it was closed. So it's a 208-acre farm. It's a vegetable farm, and so it grows 27 different varieties of fruits and vegetables. Those are planted by volunteers and along with some of our staff farmers and harvested later in the fall and delivered to our emergency food pantry network absolutely free of charge. And we do that because TFEP doesn't provide us with any fresh or wholesome foods.
And do you know others who are doing things like that to try to supplement and provide, fresh fruits and vegetables?
It's challenging because the food bank network nationwide relies on unsaleable or less than wholesome foods that are donated by large corporations or large store chains. And instead of doing that, what we do is grow our own food, which we think is a more wholesome and sort of more agricultural and Wisconsin-based approach to meeting the need.
Mm-hmm. And so are you able to get that out then quickly and get it distributed quickly?
Sometimes on the same day.
Mm-hmm. Are there other challenges you faced in trying to do this and make sure that you have the availability of fresh vegetables to?
Well, we have the fresh fruit and vegetables from April through November, and then in the winter months we don't have a lot going on, and we're back to the canned and staple products that TFEP offers.
Mm-hmm. Also, you alluded to this a little bit earlier. Ms. Brown had identified in her testimony that two programs that overlap and who may participate are SNAP and the Commodity Supplemental Food Program. And all low-income seniors are eligible for SNAP, while CSFP is only available to a limited number of seniors because of the cap on funding. And I know you work with both programs, and so I wondered if you can comment if you think that CSFP is duplicative or redundant with SNAP, and why it's important that we make sure, or if it's important that seniors have access to both programs.
Well, clearly a senior in Milwaukee could receive both CSFP and SNAP. Our experience, however, is that the SNAP benefit is at $14 and rarely goes above $90 based on the person's medical experiences and asset tests. But this CSFP program is going to provide them with a $50 box of canned and staple products. And so SNAP comes in and allows them to purchase in a very modest way anything that they might want that would be fresh, any meat or dairy, any kind of cheeses, any vegetables or fruit, frankly, because there's just going to be 2 cans of fruit and 4 cans of vegetables in the CSFP box.
Or things that maybe personally are more appealing, as you were referring to earlier, too.
Yeah, canned beef stew. They get 1 can of canned beef stew or 1 can of beef and juices. Instantized milk is not a favorite of most people. And sometimes they're given foods that they can't eat, like grapefruit juice.
Yep. Thank you very much. Mr. Nader, what do you think is the most effective method of reaching SNAP households through nutrition education that you found in your experience so far?
Well, honestly, the Cooking Matters program, I can attest, is working well. It's a very structured, formatted program, and we take them through each step of the way, and at the end of that 6 weeks, I feel like they've come a long way from where they started to be able to make the wise choices and be able to empower themselves to shop accordingly.
And if we kind of turn that around, what do you think are the greatest challenges, or what things would you like to be able to do differently that you think would help make it more effective?
I would say just if we could access more folks, you know, it's all volunteer-based. I'm out there on the front lines. Each class is usually someone from the nutrition field, say a volunteer registered dietitian, and then a chef. Mm-hmm. And so we're, you know, constantly struggling to get proper volunteers, and then once we have that in place, I'm out there, you know, making sure we get the folks out there to teach the classes, but then to get, you know, getting people aware. So I guess awareness would be the answer.
Well, thank you very much. I yield back. Thank you, Madam Chair.
Thank you. The chair recognizes Congressman Gibbs for 5 minutes.
Thank you, Madam Chair. Thank you all for witnesses coming in, and thank especially Mr. Nader to hear your story and your continued work to help people. That's admirable, and I think it actually helps the program because you get more credibility and to the whole program and the system. And I know the ranking member in his opening comments talked about protecting food stamp or SNAP funding, and I think the best way to protect it is to make sure that it isn't being abused, because I know, I forget which network did it, but there was like sometime last year, I was an expose about you know, a surfer out in California living on food stamps and eating lobster and everything else, and you know, obviously things happen, but you know, when my constituents see that, then they get, you know, upset, and that doesn't help people that need the help. So we want to make sure that people that actually do need the help, they make sure they get that help. And I want to, Miss Rach, how do you say your name?
Rashidi.
Rashid, and I guess Ms. Brown had a little bit in her testimony, but your main points, you talk about the duplication and inefficiency exists in these programs that as they are currently administered. The decentralized nature of the current system means that knowledge about how to help families with food needs is lost, and families are ultimately hurt because the system is not set up to treat them holistically and likely requires more government dollars to administer than is necessary. And then you go on in your next paragraph in your written testimony, you talk about how in the last 10 years, nutrition assistance has grown 78%, while the earned income tax credit increased 46% and SSI increased 23%. And then you say that you don't expect to return down to prior levels. And we obviously from 2008-9 went through the Great Recession, I guess they call it, and a lot of people lost employment, and lost their jobs. We see it coming back. Why don't you two respond? You know, what's happening? Why do we see such a rise? You know, almost twofold versus the other assistance programs, and now we see unemployment coming down. In my area, we've got I got employers begging for workers that can't find them. You know, it might be because we're kind of the energy side, kind of been driving some of that. But can you maybe elaborate a little bit on what's happening? Why we're seeing we should be seeing the food stamp cost coming down if the economy is actually improving or
Right.
Go ahead.
Right, and I expect it will come down, but as I mentioned in my testimony, probably not to prior levels, and there's a couple major reasons for that. One is just changes that happened to the program around 2008 with the Farm Bill and other changes. One is the elimination of the asset test in most states. So there is an asset test where you can only have, I believe it's $2,000 in assets. That has been eliminated in most states. In New York, we attribute much of the increase that we saw after 2008 to the economy and to the elimination of that asset test. The other key component is the categorical eligibility for Tanf, which is up to 200% of poverty. So states have used that to then enroll families into SNAP because they're categorically eligible for SNAP if they're receiving TANF. So I would say those are probably the two main things. Okay. The third, is the ABOD, elimination of the work requirement during the economy. But as the economy improves, that should be reinstated in most places.
Let me ask you a question on that, because I think in Ohio, Ohio had that program. I think then the governor, in certain areas where the unemployment dropped, rescinded that program, but kept it in certain pockets. That's correct, how that functions?
Yes.
Okay.
Yes.
Just another question for you, because I think it was, you mentioned that a family of four gets $650 a month for SNAP?
If they have no other income, yes.
If they have no other income. And then, and I think they already had a discussion a little bit during the school year, if they have, if their dependents are going to school and get, breakfast and lunch, that's an additional, there's no factoring in, like when summer hits, there's no change in that. So would should be some more coordination, between just that, not just that, but just all the other benefits are available, to put this together in a package, and would that help with the duplication and efficiencies? I guess it would. I mean, that's a no-brainer, but would you have suggestions how that could happen at, say, at the county level or local level to help get the coordination of benefits so it works better?
Sure. I think, data sharing, I mentioned that before, but I think that is key in just sharing data across programs. In New York, it's difficult because WIC is operated out of the Department of Health and SNAP is operated out of the Department of Social Services. So there's not a whole lot of opportunity for coordination there. If there was an opportunity to share more data across programs and also potentially share workers, so that workers were familiar with both programs and that when they saw a family, they could talk about both programs. That doesn't happen currently in New York City, and I don't think we're unique in the country. I don't think that probably happens in a lot of places. So that's just one example that if that could be achieved, I think that would save on administrative costs, definitely, because you're reducing the amount of workers and the amount of time they have to spend with families, but it's also just helping the families because they can be treated more holistically.
If the gentleman would pause, to be fair, the clock was not running for about a minute, and so I'm going to have to.
Oh, that's fine. I yield.
Now that you're on the clock, thank you. That's okay. The chair recognizes Congressman Aguilar.
Thank you.
Thank you, Chairwoman Walorski and Ranking Member McGovern, and thank you to the witnesses for joining us. As we know, food insecurity is a critical issue throughout this nation, which is why SNAP plays a crucial role in connecting families with accessibility to healthy and nutritious foods. Before I ask a question, and I may only get to one, I wanted to first take a few moments and talk about recently, I went through the SNAP challenge with my wife. Alicia and I completed it a few weeks ago. Following in the spirit of Ms. Del Bene and Ranking Member McGovern, my wife Alicia and I in the district lived on $4.73 a day, which is the average amount for an adult CalFresh SNAP recipient. We chose to do that to learn more about the 30,000 families in my district who experience food insecurity every day and to raise awareness for hunger and nutrition. We started by going to the store on Sunday and used the $66 amount in food to get us through the entire week. We understand that SNAP is meant to be supplemental, as Ms. Tussler mentioned, but for many families, SNAP makes up the majority of their food budget, so we felt it important to try to live on just the SNAP budget. As we shopped, we were conscious of our budget and the balance between what was healthy and what was affordable, and for us, that put a premium on planning 21 meals at one time. I did this challenge for 1 week, but for tens of thousands of families in my district and thousands of families throughout this country, they struggle to make that budget and to plan their meals, and they struggle with food insecurity every day. Oftentimes, they're working multiple jobs, and they're pressured to choose between what is nutritious and what is affordable. And even then, they still go to bed hungry or wake up hungry without an end in sight. I shared my experience with my constituents on Facebook and social media, and the local newspaper ran columns each day about my experiences. A few of the biggest concerns I found throughout this challenge focused in two areas. One was the concentration of families who may qualify for SNAP but are unaware that it is available to them, as some of the panelists have mentioned. And the second was communication between government and recipients so that families understand their food options and have an opportunity to better plan those healthy meals. In the city of San Bernardino, where I represent, 37% of the population relies on SNAP to help put food on their table. I'm sure that number is pretty close to what Mr. Nader sees in Detroit and other communities around this country. These families deserve access to healthy planning for their households. For example, seeds can be purchased with SNAP funding, something I'm sure many recipients are not aware of. Given the large, so here's my question, and I'd like to hear from Mr. Nader and Ms. Tussler. Given the large enrollment gap we see in districts like mine, what types of resources can Congress and anti-hunger organizations provide to help alleviate food insecurity in communities where people are living below the poverty line, but have not applied for SNAP assistance? How can we help those families overcome that stigma or that barrier to register for SNAP?
States are eligible to apply for SNAP outreach funding, and typically those resources go to outreach to vulnerable populations, seniors who don't know that they're eligible for the program, lots of people who think that maybe it's a program for somebody else for whatever reason, limited English proficient, elderly, blind, and disabled folk. And most of those programs are operated by nonprofits who are in touch with specific populations and can provide culturally competent services in languages other than English.
Does every state apply for those outreach funding?
Not every state does.
Thank you. Mr. Nader? Thank you. I don't really deal with that end of the Sure, I guess just the general stigma associated with it. I mean, you see families every day.
Sure, I've experienced that personally as well, and, you know, I think the fact, I alluded earlier to the part of the Cooking Matters program where we take them to the store to shop, and being able, Ms. Tussler also alluded to that earlier, where being able to go and do that on your own with dignity, shop, choose wisely what you pick, and then use those resources accordingly is a very important process.
What more can we do to help with that process? I mean, is it continued community outreach that Ms. Tussler mentioned? You know, where does the government role meet that nonprofit role and that hat that you wear? No pun intended, Chef, but that hat that you wear that helps connect families and helps that education side?
Yeah, I would say that's exactly what's needed. You know, in Detroit, the needs are great, and I would say that, you know, the continued education portion of this is just essential.
Thank you very much. Thank you, Chairwoman.
Thank you. The chair recognizes Congressman Yoho.
Thank you, Madam Chair. I appreciate all four of you being here with your testimony, and just kind of for the record, what is your, just one of you pick it out, maybe you, Ms. Brown, what is your definition of food insecurity? You know, we are tasked with this committee to be the ones reforming this program. 80% of the money in the farm program goes to nutritional programs. So for us to reform that so that we're all on the same page as we move forward, so that we're all in agreement what we're trying to accomplish, if you would give a definition, and I would like for the other ones if you agree or not.
Well, rather than my own personal definition, I had a feeling this was going to come up, so I brought the definition that is used in when they do the survey every year, the kinds of questions that they ask. And food insecurity is household members that were at times uncertain of having or unable to acquire enough food for all household members because they had insufficient money or other resources. And then there are definitions below that for low and very low food.
Okay, for the record, that's going to be entered in there. Are we all pretty much in agreement with that? Does anybody differ from that on the panel?
I guess I would just suggest that we believe that everybody has the right to adequate dignity, or food obtained with dignity, and we would add that the foods should be healthy.
Okay. I want clarification, because we move forward. We're going to make policy changes or add to or take away, and we want to make sure that we're in agreement with that. And then, Ms. Rashidi, you brought up, what is your definition of treating these families holistically? What does that mean? And again, this is for clarification.
When I talk about treating a family holistically, I mean being able to communicate to them all of the resources that are available to them through the food assistance programs. So
Okay.
having a worker that has knowledge, if they can't enroll them directly into all the benefit programs, they should at least have the knowledge of those programs so that the families can be aware of those.
Okay, and I'm working somewhere with this, and Mr. Nader, you brought up about your background. I can appreciate that, as this panel's heard. I grew up in a wealthy family, or high, upper middle class, until we went broke. And then my parents got divorced. Our house got repossessed when I was 15, and I was out on my own at 18. And my wife and I got married at 19, and we were on food stamps for a short period of time. You brought up the thing about Ms. Tussler, is that right? My eyes are failing me. About the dignity. And I remember having the coupons, the food stamps, and there was a stigma, but I was so thankful they were there, but I was also it implored me to work harder to get off of them as quick as I could. So I don't think that's a bad thing per se. And you know, like you, Mr. Nader, we got off of them, but it was there for us, and it did raise us up. We got in, we moved up, we moved out, and I hope that's the goal of all of this, because I hear stories like Mr. Thompson brought up of the surfer that was on one of the news channels, but unfortunately, we see that in our districts, and I hear stories about that every day. And so to reform these programs so that they do work well, we need that information. And then I want to ask you, because as you're treating holistically, I hope we also talk about responsibility. You know, if people are out there, they're struggling, they're making a living, they're doing the best they can, absolutely. But also, you know, when I look at programs that were feeding breakfasts at every school, and then it was breakfast and lunch, and now it's dinner, and now it's take home. Where does it stop? And, you know, as we're talking to people, are we counseling them on the responsibility of a family, of feeding them? And then you were talking, Mr. Nader, about teaching people how to pick out foods properly, teaching people how to cook properly. Is that the role of the federal government, or where do we break down in society where it's not passed on from generation to generation?
Well, I think that, you know, preserving the SNAP Ed aspect of that helps people give the skills, so when they do, as you had done, and get off the program, you're able then to sustain that. You know, it's the sustainability aspect of that educational piece.
I've got one more question, and if you guys, if you don't have time to answer this, if you could put it in a written answer. We've heard over and over again that there's a lot of programs doing the same thing. Is there a way to centralize this so that we don't have 2 or 3 different agencies and 18 different programs sending all this out for the duplication? And I understand the argument of the duplication, how it does cover up and cover some people that might have been missed. But if we can centralize it, it'll cut the cost and make it more effective. If you could respond to that, it would be greatly appreciative. Thank you.
Thank you. The chair recognizes Congresswoman Adams.
Thank you, Madam Chair. Thank you, ladies and gentlemen, for your testimony. I appreciate the government accountability, these offices mentioning that participation in SNAP and WIC and school meal programs are associated with positive health and nutrition outcomes. We need to do that. I recently hosted a roundtable in Greensboro, where I live in North Carolina, to discuss food hardship in my district. I heard firsthand testimony of Melanie Noble, a SNAP recipient, who struggled for 3 months to recertify her family's benefits after she moved to Greensboro from Pennsylvania. And while living in a homeless shelter with her 2 children, she had to depend on donations from other SNAP recipients in order to feed her family. According to the Food Research Action Center, the Greensboro High Point area, where I live, currently ranks first in the nation for households struggling to pay for food through the end of the month. From the Triad to Charlotte, communities in the 12th District of North Carolina are above the average, are above the national average when it comes to struggling to put food on the table. SNAP benefits are simply not enough. Other federal food programs such as school meals and food commodity programs help families make it to the end of the month. Each agency that administers a food program has the capacity to maximize access to these programs for their specific constituents. So any review of food programs must thoroughly examine the consequences of consolidating programs. We can't allow families who are currently eligible and need food assistance to be denied support in order to reduce costs. So, Ms. Rashadi, the story that I just shared about Ms. Noble is an example of churn. Households going off, coming back on SNAP within 4 months due to a change in life circumstances. Churn is not only inefficient, but expensive. So do you have any recommendations about how to lessen churn?
In practice, because we often would hear about churning, and I'm talking mostly about the SNAP, or about SNAP, when people when people have volatile income where they have changes in income frequently, in the program, they really don't report that until every 6-month recertification period, so that provides them with a little bit of a grace period in terms of their benefits. And so this idea that people go on and off, it really is more related to the recertification periods, which are 6 months to a year. So people don't go on and off SNAP every month.
Okay, Ms. Tesler, it's been mentioned that the school lunch program and the school breakfast program are managed separately, which could lead to increased administrative costs. Would combining the administration of the lunch and breakfast programs make it more difficult for schools to participate in the school lunch program?
Combining the administration would definitely streamline things. Under the community eligibility provision, what we found is that schools can provide meals to 100% of the student body, a breakfast after the bell, lunch in a more organized fashion as a result of not having to collect paperwork and pins from students who are waiting to eat. And so in school districts that have 60% or higher levels of poverty, which is many school districts in Milwaukee, the entire school district, the community eligibility provision allows the school district to feed all children that are in our care when they are in our care. So I think that community eligibility provision is something that the committee should consider and take back to their communities because we know that it works.
Thank you. Mr. Nader, quickly, do you believe, or what do you believe is the biggest barrier to improving the nutrition of SNAP recipients? Is it the cost of fresh produce, for example?
Well, that's definitely one. I think, we do teach, while fresh produce is ideal, unfortunately, not everybody has access to that, so therefore, in that program, we make sure that we talk about frozen and canned produce as well, because we have to be honest and realistic with it. But, so, I mean, the cost is definitely one of the issues for sure.
Thank you. Madam Chair, you're back.
Thank you. Chair recognizes Congressman Molinar for 5 minutes.
Thank you, Madam Chair. I want to thank all of you for speaking with us today, and Mr. Nader, I also want to thank you for sharing your story with us, and as a Michigan person, I appreciate what you're doing for the Lions and also for the people of Detroit, so appreciate your efforts. I wanted to talk with all of you, maybe we could start with Mr. Nader, about the role of the private sector and the faith-based community. One of the things that struck me about what you said about the Cooking Matters program is that you've really been able to form partnerships, and you mentioned Walmart and some others. And what have you found helpful, if you would start us off, engaging the private sector and kind of mobilizing resources that way, and if each of you could kind of respond to that as well.
Sure. The model we use for Cooking Matters in particular is there are some SNAP Ed funding that goes with that, and then just as you stated, some of our community partners as well as corporate partners to help sustain a program like that, because it is very formatted and structured, and there's materials that come with it. There is cost to it aside from the food cost as well. I could get back to you as far as to the actual breakdown of how that works with the SNAP, what actually comes out of the SNAP Ed, but it's a little bit out of my expertise as far as, I'm on the front line teaching these classes, but I know that model has been working good for our program.
And you mentioned there's yourself as a chef and a nutritionist that works, and one of the needs you have is for more volunteers to maybe help with this. What have you found is probably the best motivation for people to be engaged in the program?
It's kind of a vocational call. As far as when I'm talking to fellow chefs, as members of the food community, I feel that we're obligated in a sense to participate on that level. And so that's kind of how I approach it with the chefs. As far as the nutritional side, that's a little more technical, but I feel like at least some of the registered dietitians that we've used and people that are in the medical field on that end, they kind of feel the same way as well.
Hunger Task Force is a nonprofit, and last year we raised $6,174,000 in private sector resources. The farm is supported by the Harley-Davidson Foundation. Many of our food drives are supported by Johnson Controls, Miller Coors, Northwestern Mutual. Kohl's Department Stores pays for all of the summer suppers at a tune of $500,000. Individuals volunteer as many as 7,000 annually. And Hunger Task Force is able to collect more than 59% of the food that we distribute from the local community, not relying on large corporate resources, but instead food drives. And so I think that we've organized sort of the local community in a really great way, and, you know, a great tribute to the citizens of Milwaukee for their efforts, but I don't think that the efforts of those people could any way, shape, or form replace the effect of the SNAP program on a community, because the work that we do is, and the federal budget would reflect, about 4% of it is TFAP and 70% of it is SNAP. And so if we dismantle SNAP and we push people towards charity, we're going to break charity. And charity is 70-year-old people from churches. So there's only so much they can do, there's only so much that the private sector can handle, and there's only so much demand that each community can meet. I would like to remind everybody that I grew up in 1977 when there weren't food banks across the nation, when there weren't soup kitchens and homeless shelters, before we had sort of large and wide-scale poverty in our nation, and we should stop allowing it, and we should start questioning why we think it's okay to have food banks. And I operate one. I would welcome people to put me out of business.
Ms. Rashidi, did you have a comment about this at all?
I definitely think there's a role for private sector and charities. I think it's not realistic to think that a federal program can provide for every situation of every family and every food need. So I do think that there's a role for the private sector.
Well, I was thinking about Milwaukee and how one of the things that we notice when we go from place to place across the country looking at programs is not every local community has the same amount of mobilization and support. And so our concern would be trying to make sure there was equity across different areas.
Thank you. I yield back. Thank you, Ms.
Thank you. Congresswoman Lujan Grisham.
Thank you, Madam Chair, and I too want to thank this panel. I mean, the resounding theme, and I think also of the subcommittee is that we would all rather talking about not the need for additional programs. I, like everyone else, would like to stamp out hunger in this country, and am dismayed every minute of every day that we aren't there. And in fact, I represent a district and a state with the hungriest children in the country and one of the highest adult hunger situations in the country. And it's demoralizing, it's inappropriate, and it's something that we can work together to absolutely eradicate. And so each of your roles to get there is commendable and incredibly important. And I recognize the value, too, of figuring out the best ways to administer these programs and the best ways to leverage them. And, you know, I was the cabinet secretary for the aging department in New Mexico for 14 years, so 3 different governors, 2 parties, and I will tell you that government eligibility standards nearly drove me to drink. So they're difficult, and one of the things I want to think about is while we can debate, and we do, and we will, categorical eligibilities and the benefits of that and some of the weaknesses potentially in that, the fact that we don't do data sharing, the fact that it's very difficult to administer programs. I've got a senior center with a child care center because grandparents are the fastest raising grandchildren. That's another statistic that my state's one of the highest in the country, but we can't do meals for kids at that center, and we can't use senior center funding for meals for seniors because the federal government doesn't allow you to leverage, because we call that supplanting, one program for another. And if you touch those programs, by and large, we're a little bit better today. I'm old, but we're a little bit better today, but not much. And in fact, you are penalized. Really, it's counterproductive to leverage programs, to administer together, to share data. The same thing, we're now doing community school-based health centers that provide health care, not just to the students, but the the entire families, but we can't share food in a school setting. And a grandparent or a parent who's hungry is no good at helping the other social issues that that child has. I mean, having these huge gaps don't make any sense. And so I've got a question, I promise, in here somewhere. The second thing is, I really appreciate that, even though I was not here for every question, I really appreciate that there was some discussion about what's appropriate. We don't do really any therapeutic diets in any of these programs because we can't afford to do that. Your point, Ms. Tussler, about grapefruit juice is well taken. Now let's talk about a recent study about vitamin D deficiencies and dementia, which cost this country hundreds of billions of dollars preventable. That's before we talk about vitamin B deficiencies, where if you don't deal with that deficiency and you don't do the right nutritional standards and you don't have the right nutrition, then you have permanent dementia. We're right back to hundreds of billions of dollars dealing with diabetes, healthcare, dementia, and long-term care services. So, if we were to leverage better, and we eradicate hunger, and we do all the things that we know would make a difference, could we at the federal level, to promote the sharing of these programs and leveraging, so we do single delivery, that we're really clear that the centralized kitchens for seniors can be used in these varying ways, and that school kitchens and your work, Mr. Nader, is there a way to promote the sharing of these programs between federal programs, which are today mandated not to work together? Do you think that could have an impact in promoting best practices in the states? Anyone?
Well, I definitely do. I mean, I think the fact that it's a fragmented system starting at the federal level is much of the reason why that trickles down to the state and local level.
Okay.
And I'd just like to add that the idea that our recommendation that the USDA form this panel that brings in people from all different levels, federal, state, and local, and people that have had experiences like you and others on the panel have had, that can share together and look at where the gaps are and where there are opportunities for more efficiencies. And that it starts at the federal level, and I can't resist saying it also, the fact that this crosses over multiple congressional committees creates a challenge as well that needs to be dealt with or overcome.
Absolutely. Well, I really appreciate, I've got very little time left, that perspective, because I agree, and I think that we could promote that as a best practice and maybe mandate it in some form, and I think we would see some pretty incredible results. So I appreciate your work, and with that, Madam Chairman, I yield back.
Thank you. The chair recognizes Congressman Abraham for 5 minutes.
Thank you all for being here. I have lived and practiced medicine in the Louisiana Delta all my life, so my district is certainly one of the most poorest in the nation. They have major newspapers come down and do full-page reports on us as how poor we are. So it's, it's critical. I mean, I've seen hunger, and I don't think there would be anybody in this room that would want a child or an adult to go to bed hungry. I'm looking, Ms. Brown, I'll direct, I guess, my comment and my question to you. I'm looking at page 2 of the GAO highlights that you provide us, and thank you for that. And I counted down, and there were 18 programs, and you can correct me if I'm wrong. It looked like about a third of them are targeted for children. And I guess my question or my comment is, with the shrinking dollar, the shrinking economy that we're having to deal with, and I'm up on the boldface, it says the federal government spends about $100 billion on these 18 problems in the fiscal year 2014. So we're going to have to get more efficient with our dollar, it looks like. All these programs, especially the 6 or the third that are targeted for children, are they coordinated where you're getting your most for your product? Are most of the children getting positive results, or are these programs just kind of, well, this one may work, this one doesn't, let's throw them in the pot and see what happens?
Well, first of all, I think it's not surprising that so many of these programs are targeted to children, because over time, as there's been need defined, then new programs have been started. But we certainly see an opportunity for better coordination and better looking systematically across those programs to see whether there are efficiencies that could be achieved.
Mr. Rashidi, you said that WIC and SNAP are administered by two different federal agencies. Is it even logical to assume that as Congress we can attain that goal? Is there hope out there that we can coordinate these programs and make them more efficient?
I think it would be difficult to completely combine them and coordinate them, but I think there are opportunities to take a look at certain aspects of the program that could be coordinated. And I don't know all the details of that, but there definitely are things around, just even the retailer certification I described earlier. It's completely separate in the two programs. So I think there are certain areas, but yes, I think it's probably unrealistic to think that they're going to be completely combined and operate out of one federal agency.
But there certainly is room for improvement and for some coordination that we could legislate, hopefully, and make them more efficient programs for our people.
Yes, definitely.
Brown, you have a comment?
I was just going to say that we just released a report today looking at services that are needed to help older adults stay in their community. And while we're talking about children, I think it's also important to think about the fact that we have a number of programs that are serving older adults that do everything from, delivering meals to congregate care to parts of the SNAP program. And that's another area where we expect the demand to increase dramatically, and it will be all the more important to make sure we're using those resources efficiently.
Okay, thank you. I yield back, Madam Chairman.
Thank you. The chair recognizes Congressman Davis for 5 minutes.
Thank you, Madam Chairman. Can I possibly get the minute 14 seconds he yielded back to?
Oh, that would be negative, so continue.
That's all right. That's all right. Mr. Nader, great to see you again. It was great to speak with you. I thought you promised me yesterday when we met in my office that you were going to bring me examples of what you cooked for Ndamukong Suh when he was playing for the Detroit Lions. And I see nothing.
That's correct.
Yeah. Well, much appreciated. We'll welcome you back another time to demonstrate some of the some of the things that you do within your Cooking Matters program too. So thank you for what you do. I'm sorry I missed opening testimony. I appreciate all of you being here, and I think this is a great opportunity for us to here in Congress to get an idea of how certain programs are implemented and the concerns and the problems that you may have with those programs being implemented. I'll get to my first question for Mr. Nader. You, and I hope I'm not redundant, so forgive me if you've already answered this, but you benefited from both SNAP and school meals as a kid. And can you expand a little bit on how those actually worked with you and your family?
Well, I mean, the lunch program, I think, speaks for itself. That was most often the program that we used. And then with the SNAP benefits, again, it was, there were small times and needs in the way the auto industry economy worked back when I was a kid. There would be plant shutdowns or downturns when things wouldn't, and that's when things would get tough and we would have to go on a program. But it was never really a permanent situation, luckily. So, and I think that's a big misconception, that there's a lot of folks that are on it and then they stay on it. And the fact is these are working families, and then they utilize the supplemental aspect of this when needed.
In your case, yes, that was the case. And are you seeing that same trend with many of the participants in your Cooking Matters class too, where they're on and off the programs? I believe in our particular case in the Detroit community, that's the same thing. Many of the families and the kids of the families I'm working with are working families, and they're just simply not making enough money to carry through all the way, and then that's where that supplemental aspect comes in. Okay, well, thank you again, and again, I wish you success this year, except against my Oakland Raiders.
Thank you.
That's all I can say. Ms. Rashidi, I used to work for another member of Congress, and after disasters or on an annual basis, DHS through FEMA would offer assistance for communities. And it seemed to me that it could possibly be redundant. And I know your experience in New York City can you tell me if there are any issues that you may have faced with redundancy between USDA programs, DHS programs, and anything you would offer us as a committee to try and fix that?
Well, I think the emergency food programs are a little bit redundant, and it seems like, from my perspective, the CBOs that have to kind of cobble together the different funding sources to support their emergency food programs, it does seem, and redundant may not be the right, just not coordinated, and why does it have to be from two different funding sources when really it could be from one? And then in terms of the emergency aspect of it, in New York City when we had Hurricane Sandy, I know that there was coordination across those two different programs, and so it happened, but really ideally, again, why should you have to coordinate across two different programs that are really providing the same thing? So it has to happen. You have to coordinate during emergencies, but really it shouldn't be like that.
So what you're recommending is that USDA get control of all of these programs, so this committee has jurisdiction, right?
Sure. You said that.
Hey, you just did. Thank you for your recommendation. Madam Chairman, I yield back the balance of my time, but thank you all again.
Thank you. The chair recognizes Ranking Member McGovern for 1 minute for a wrap.
What, that's it, 1 minute?
Yeah, a minute.
2?
Oh, yeah. We doubled from last week.
Yeah. Well, thank you. Look, let me just say that I'm all for better coordination, and we ought to be able to do that. And there are challenges because, as was mentioned, a lot of these anti-hunger and nutrition programs fall under multiple committees in Congress, under multiple agencies. But I'm also for a plan to end hunger. We don't really have a plan in this country to end hunger. And I have, with this administration and the previous administration, been urging the White House to put together a White House conference on food, nutrition, and hunger, and bring all the various agencies and all the stakeholders in a room and the beneficiaries together and work this out. I don't know whether we need, I don't know how practical it is to say we're going to legislate that all anti-hunger and all nutrition programs will fall under one committee. But I think a far less arduous task is to maybe ask the White House to do staff meetings with various people from various agencies on this issue. I mean, these are solvable problems. Let me just say one other thing here. My colleague, Mr. Yoho, mentioned that we're tasked with reforming the SNAP program. I get really nervous when I hear that. I want us to first fund it adequately, and I want us to make it work as best as possible. The reason why we have all these other programs that we're talking about is because there's a need. There's a need that wasn't being met by the existing benefit. And that's just a reality. And anybody who tells you, and I have to say this, I really feel strongly about this, that this benefit is enough, ought to live on it. I mean, Ms. Tussler talked about the 76-year-old woman, Molly, who, because of what this committee did in the Farm Bill, saw her benefit go from $90 to $16 a month. That's crazy. So, let's organize. Let's try to get the White House to take leadership on this. And let's figure out how best to do this. But let's not. Just one last thing here. Just one really last thing. Just because I think it's important. Because I want to make sure the record is corrected on this. We heard a couple of times mentioned the guy who's a surfer on food stamps. That is not the reality of the program. And it's our job to tell anybody who says it is that it isn't. The majority of people on this program are kids, are senior citizens, are those who are disabled. And of those who are able-bodied, the majority of them work. Given the opportunity between working at a job that pays a wage where I wouldn't have to rely on this benefit, or a job that I have to work full-time and I still need to rely on SNAP, I mean, we know what people would decide. So let's not demonize this program by taking some examples that may have appeared on some news show that I won't mention the name of the news show, but anyway. But the point of the matter is, we ought to be we ought to make sure that the narrative that we are echoing here reflects the reality. And we can do this, but we also need to make sure that the funding for these programs, for SNAP in particular, is adequate. And I thank the Chairwoman for her indulgence.
Thank you, Mr. McGovern. And I just want to add my thanks to the panelists in this hearing. I think this hearing today exemplifies why we're even meeting on this committee. We've heard good information. We've heard information that there are efficiencies that we can do. We've heard it from both sides that, this issue with data is clearly something that needs to be looked at, and that, the fact-finding that we were looking for is exactly what we found today. And Ms. Tussler talked about overregulation on the food commodity program, and which is exactly why we want to look at these programs, have an actual in-depth look at the past, the present, and the future, and what can we do better, because we can always do better. And that's really what the focus of the committee has been, and I think that's what we've heard today. Good, solid information that helps us make decisions, because you're the experts. I very much appreciate you being here today, appreciate all the input. So under the rules of the committee, the record of today's hearing will remain open for 10 calendar days to receive additional material and supplementary written responses from the witness to any question posed by a member. This hearing of the Committee on Agricultural Nutrition Subcommittee is adjourned.